if you've been pregnant, you probably found out that having babies for our body is amazing. Not at all. I will talk about a few issues today regarding postpartum. So these are issues I've personally faced with, so I'll be able to go into detail regarding that and my experience with it. So the 3 topics I'll be talking about today is depression, hair loss, and gallstones. Now I'll quickly get into the video with saying a quick introduction with my birthing story. I do have a separate video. I had a 30-hour labour followed by emergency cesarean. It was quite a stressful labour, I'd say. It's also my first baby, so a lot of these things, actually all of these issues, is the first time I'm facing with them. Now, number 1, postpartum depression. I feel like it's not being spoken enough about. When I was going through it in the first couple of weeks, and I was trying to look up stuff just so I can kind of relate to stuff and make myself feel a bit better that I'm not the only one going through it, there was so minimal information, which made me really angry because I'm not the first to give birth. Now, if you're watching this and you've been through it or you're going through it at the moment, I want you to know it's okay, because you've just gone through such a major change. Postpartum depression can happen at any point. It can happen straight after giving birth or up to a year. I personally went through it the first couple of weeks. I think I still go through it every now and then. And it's a scary place to be in, and nobody needs to be in that place and think that they're going crazy, because you are in a way, but it's okay. We all are. We're all going crazy. Having a baby is such a big change, physically, mentally. Your hormones are all over the place. You don't look the same, you don't feel the same. So having depression is completely normal. Plus you are sleep deprived on top of it. So you can go crazy, you can have scary thoughts. And I want you to know those dark thoughts, they are normal to an extent, as long as you don't physically act up on it. Let's put it that way. But those thoughts are the first couple moments when I had those scary thoughts, those dark thoughts. I thought I was going crazy. I thought, this is not me. There's no way I'm even thinking of what I'm thinking, and it's a scary place to be in. But then I reminded myself that I am sleep deprived. I am, my hormones are all over the place. Your body has gone through so much. So at this time, it's very important for you to ask for help. Now, I'm not a person to kind of ask for help ever, but do try things that makes you happy. So for example, what I did when I was going through the cluster feeding stage, if you know about cluster feeding, it's a nightmare. If you're going through that, good luck. Remember, it's all a phase. Anyway, so when I was going through the cluster feeding stage, I did things that would make me happy, and that stage I would put something on Netflix to watch, something I really enjoy, the shows, or I would get some naughty snacks, and I did things that would make me happy to kind of balance out the hard and the scary that you're going through. Now, I did want to mention specifically a Russian sleeping experiment. If you've heard a little bit about it, you might know about it, but apparently at some point during the war in Russia there was a sleeping experiment. I don't think it was confirmed to be true, but I do believe they did some weird experiments back in the days. And what basically happened during the sleeping experiment is lots of prisoners, I believe, were put into a room, and they released gas that would stop people falling asleep. And the experiment lasted like weeks, and you can imagine what that can do to your mental state, not being able to sleep for weeks and weeks, even just a couple of days. And the reason I mention that experiment, because I feel like us mothers go through something similar in the beginning stages. I'm now 6 months postpartum and we still wake up every 2 to 3 hours, but I want to tell you that it gets easier in a way that you learn how to deal with things. So in my case, I used to, get up every 2 hours, breastfeed sitting up while falling asleep pretty much, which is dangerous, and then put her down. Now I've now adapted to co-sleeping. Now it's of course not everyone's choice and not everyone's, for it, but that's how I've realized that's the only way I can get some sleep. Uninterrupted and away sleep is by co-sleeping. I think the only way to deal with this is to make yourself happy by doing the small things and look forward to your baby growing up. Just remember, everything is a phase, the sleep regression, the cluster feeding, the grabbing and biting, everything. So just remember, everything is a phase, so it will pass, and if you need some help, what suits you best in terms of maybe reaching out to talk to someone or to spend some time with someone or have a bit of alone, me time, just reach out and ask for help. Don't hold it in. Now let's talk about hair loss. Now this is my favorite subject just because I've done so much research regarding that, and there are so many treatments available and so many ways to prevent that hair loss. Now, if you obviously gone postpartum, postpartum hair loss is a big thing, as well as normal hair loss for anyone. Hair loss can happen for lots of reasons, so have a think what has recently changed in your lifestyle. So for example, if you've been pregnant, your hair loss is due to postpartum, due to giving birth and your hormones changing and obviously releasing all the good stuff to your baby, especially if you're breastfeeding. If you've not given birth, it could be things like lifestyle change, environmental change, could be medication, contraception, health issues, hairstyles, so many different causes for hair loss. 75% of men experience hair loss and 40% of women experience hair loss. So number one, get to the root of your problem. Have a think what has recently changed and make that change back if possible. Or if it's medication related, either come off the medication, change medication, or just know that after you finish medication, you will be able to treat it again. There are, of course, ways to avoid hair loss, so things like tight hairstyles, overusing products, and do your research regarding vitamins, see what would work for you. Biotin is more like a general one that would help everyone. Now, how to treat hair loss when you've already got bald patches. The only best way I would suggest is to go to a clinic. You can listen to all the rice water methods, but unfortunately they're not going to do anything to your bald patches. They might make your hair feel thicker, but physically it's not going to grow any hair. The only way you can treat hair loss is going to a clinic, a professional clinic that would do hair filler injections. Now, hair filler injections, they've got lots of peptides that can help with the hair loss, with the hair growth. Another thing that you could use is Minoxidil. Now, Minoxidil is the #1 treatment according to NHS. Best way to use Minoxidil is to use a microneedling device. I'll include a link where you can buy the microneedling device for home use with Minoxidil serums. And that way it gets penetrated into deeper layers of the skin where the hair follicle sits. Unfortunately, just applying Minoxidil just on top is going to do the bare minimum, and the best way to treat it most efficiently is by penetrating it deeper. Alongside, of course, have a healthier diet, and that should resolve your hair loss. Of course, there's extreme way to go to Turkey and get your hair follicles planted, but nobody's got money for that. Now let's talk about gallstones. Now that's another topic that when I was going through it, I'm still going through it, there's not enough information about it. The only helpful source I found was Facebook group and with lots of other people who are going through it. Now, gallstones is basically stones in your gallbladder, and the issue with that is every time you eat some sort of fatty foods or trigger foods, every time the gallbladder compresses, and of course where the stones are inside and your gallbladder compresses, it gives you a lot of pain. Gallstone attacks can last anywhere from half an hour to pretty much 2-3 days. If you've gone through the pain, you know how painful it is. Now, the actual pain can vary. It can be from about 3 out of 10 to 7 out of 10, but the worst part of it is how long the pain lasts and that there's no break in between. There's also no, not cure, there's no relief for the pain. The pain relief does not help. Paracetamol, ibuprofen, nothing like that helps this condition. I've been suffering with gallstones for 10 months now. I get some weeks where I'm absolutely fine. Some days I'm experiencing attacks in a period of 3-4 days consistently every time I eat. Everyone has different trigger foods, so keep a food diary, see what's good for you, what's not. So my main issues are that I can't have any fatty foods, I can't eat anything too close to bedtime or going for a nap straight after eating, and it's very important what I eat in the morning on empty stomach. So my issues are quite hormonal, so mine started while I was pregnant and got worse since I've given birth. And I've noticed mine starts the worst as my period about to start, and then as I've had my period for a couple of weeks, I'm absolutely fine and I can pretty much eat anything. So what the pain actually feels like. So I get the pain in upper stomach. It feels like a gnawing pain that keeps compressing, and it just doesn't, the pain doesn't get any better. Sometimes it starts to radiate into my upper back. As I mentioned before, the pain can last anywhere, for me personally, half an hour, and my first attack lasted me pretty much 24 hours. My first attack was the worst. Now, how to relieve, because I'm sure if you're going through gallstones, you're looking up every single method to try relieve that pain, because the pain is unbearable, and as I mentioned, no pain relief, no painkillers help it. Based on my research, what I have seen people use is apple cider vinegar. So you just take a shot of apple cider vinegar, and apparently that helps. I've not personally used it, just because I was scared of that acidic, but according to lots of people, it has helped them to relieve that pain. Worth a try. What I forgot to mention is that my issue is also hereditary. So my mum, my nan and my great nan, they've all experienced gallstones, especially during pregnancy. So my nan, I know she ended up having a surgery to get gallbladder removed, but my mum, however, she still has gallstones to this day, and her attack was 29 years ago. But she's been eating super healthy since, and she gave me medication to try that you can buy on Amazon. Remedy, medication is the wrong word, remedy tablets. So I've used them. I feel like sometimes they work, but sometimes they don't. But at the same time, I do eat a lot more unhealthy than she ever has. Now, I have seen some people talk about doing the flushes. Now, flushes can be very dangerous because it's not quite, kidney stone where you can just flush it out. Now, it's a stone and it can easily get stuck in your bile duct. Now, that can be very dangerous. It will cause you a lot of pain, and I think you can even get jaundice from it. When your skin goes yellow, your eyeballs go yellow, that's when you know you've got some further issues with this, and you should get seen immediately. I've not really seen any successful flushes. The way to do a flush, I think you drink lots of magnesium and lots of apple juice. Now, based off that flush, I did get a bit inspired by it in a way, and I've been drinking lots of apple juice. Now, I'm drinking lots of apple juice not to flush it out because it can be dangerous, but just to help me get that food through me quicker. So apple cider vinegar shots, look up some remedies maybe on Amazon, tablets to try, and just apple juice. Try apple juice. And of course, healthy eating. Issue is that once your gallbladder starts producing gallstones, that gallbladder is no good and it will always produce gallstones. That's why if you have been to doctors, they will suggest to get the gallbladder removed. So unless you're no longer experiencing any more attacks or you're no longer in pain, I would strongly to get that operation booked. I know that because mine's hormonal, now every time I will have a kid, it will more likely come back, the pain. I say come back, mine's still there, but I am down on a list for surgery to get it removed. I feel like I've covered everything. I would like to think I've got quite extensive knowledge regarding these things. So if you want to ask any questions down in the comments, I will answer them to the best of my knowledge. There's lots of other health issues that comes with pregnancy, which I was lucky enough not to experience. I hope whatever you're going through, I hope you find the light at the end of the tunnel, and I hope things get better for you.